I'm Tyler Reeve, and I'm pleased to have with me Dr. Jack Holliday, whose leadership and influence in the field of ophthalmology is known to all of us. Dr. Holliday, you're going to talk to us about a new product category, the HD analyzer.
Sure. The HD Analyzer is a product that is different than any other instrument that's on the market today. Now, it's a multifaceted instrument in that it does two things. The first thing is it measures what most of us are familiar with, which is a wavefront. So it tells us about the performance of the optics of the eye. But the second thing that it measures is not anything that any other instrument measures, and that is it measures the forward light scatter that's present in the eye. Now, what I mean by that is think of a cataract. All right, as a cataract begins to turn kind of hazy and gets foggy, what happens is the normal light rays that are very coherent and well organized, when they hit that cataract, send an image through, but then they cause a forward scatter. And that forward scatter is like a fog that you may see over things. Well, no wavefront analyzer measures that. That doesn't measure any of that forward light scatter. It only measures those coherent rays that come in. So if you get the coherent rays that are distorted a little bit, it measures that, but it doesn't measure the effect of the light scatter that falls on the retina and reduces the contrast of the image to the point that you may not be able to even see it. Just like if you looked at a house across the street and you couldn't see it because of the fog, it doesn't mean that it's distorted. It just means the contrast is so low you can't detect that. Well, the HD analyzer measures that fog, measures that light scatter. And what's happened is a very good study that's done by Pablo Artal, the actual inventor of the instrument, showed that the correlation with disability with cataracts was directly proportional to the light scatter and didn't correlate very well with the distortion that was created by the lens itself. So the light scatter was a much better visual function measure than the wavefront was altogether. So what happens is, whether it's refractive surgery where you have a patient gets light scatter from little corneal edema, whether it's a cataract that has forward light scatter from the actual density of the cataract causing that scatter, this instrument measures that and quantitates it in a way that correlates exactly with the amount of visual disability that the patient undergoes as a result of that forward light scatter. So it's a real breakthrough, because now what happens is, before, when we'd have patients that would come in of complaints of visual function and saying, I can't see very well. Well, now we have an instrument that objectively measures that, gives us a quantitative value that goes from basically 0 to 10, 10 being terrible and less than 1 being normal. And that index that we have from 0 to 10 now gives us a direct, objective, quantitative value that measures the patient's visual disability that will correlate with his symptoms and the amount of disability that he has in day-to-day life.
I think that's very interesting. Dr. Holliday, do you see this more being used in a preoperative situation, or maybe a postoperative unhappy patient, or in both, to analyze the quality of the vision?
Well, I think that the both. And I think what will happen is that the preoperative evaluation allows the doctor to correlate the symptoms that the patient's having with an objective measure. Because you may have a histrionic patient that comes in and says, oh, doctor, I can't see, my vision's terrible, and I can't see anything, and you do a measure and it's actually very good. Well, the problem with that is, if you operate them, put an intraocular lens, do refractive surgery, and they will still have complaints because the improvement that they got was very minimal and they had some other problem that was really not visual function. On the other hand, post-operatively, if you have a patient that has a problem, well, many times that was due to light scatter. It may be from an opacified capsule from cataract. It may be from corneal edema from refractive surgery. It could be from the light scatter that you get from a diffractive multifocal lens. All of those things are not measured by wavefront analyzers. They do cause a reduction in the contrast of the image that the patient sees, and they do cause a visual disability. So now we have an index that will measure that gives us a good way of, again, correlating a patient's visual complaints and symptoms with an objective measurement that quantitates that for the doctor.
Well, I think that makes a lot of sense. All of us as cataract surgeons are familiar with patients that may have 20/20 Snellen acuity, but that doesn't correlate with their objective findings nor their subjective ones. And to quantify that will go a long way to treating the patients and also evaluating them postoperatively for complaints.